Hello, my name is Dr. Michael Stefan, and I'm the medical director and a board-certified plastic surgeon here at NipTuck Aesthetics in Miami. I should be meeting you soon, and I look forward to that opportunity, and we feel privileged to have you as a patient. There's just a few things I'd like to go over before you actually come to our facility for your surgery. Patients often have a certain degree of concern or anxiety over what to do before surgery, what to do after surgery, and one of the things I want to tell you is we have all of that covered when you come here. What I want to tell you is we give the patients an extensive guide on the use of nutrition, the use of faja, and for surgical procedures of the face, facelift instructions, and rhinoplasty instructions. So we do all surgeries here, from facial, rhinoplasty, otoplasty, breast, liposuction, abdominoplasty, lower body lift, inner thigh lift. Everything we do, we've done here, and I've been doing for the last 30 years. Now, the first thing everybody's aware is that smoking is a no-no. It's very hard to stop smoking if you smoke, but it's very much worth your while to do that because your recovery will be so much better in terms of how well you recover as well as how good the final results are. Smoking causes excessive fibrosis after liposuction and tummy tuck. We cannot even do some surgeries such as breast lift if you're nicotine positive. So how do you stop before surgery? Well, there's a variety of methods to stop smoking, and the one I prefer is Chantix. Chantix is a medication that has profoundly successful results to stop smoking. Over 80% stop smoking permanently. I'll even tell you, I smoked in my lifetime, and I actually took Chantix to stop smoking, and it was successful for me. If you smoke after surgery, that's a real big problem, but what I want to tell you is smoking is just not cigarettes. It's vaping as well, and the toxins in smoke and vaping are extremely toxic to BBLs. The fat cells will die. So bottom line, smoking, please don't do it. If you do it, be honest, let me know, and we'll work with you in improving it. What about medications to avoid? Well, largely these medications are medications that can cause bleeding or excessive bleeding during and after surgery. Everybody knows that aspirin, for example, can cause bleeding, and we include in that list all non-steroidal anti-inflammatories such as naproxen and or ibuprofen, that's Advil, those type of medications as well. In addition to this, Aleve and or Coumadin for blood thinning is obviously something that has to be corrected before surgery. We do tests to check your bleeding potential and make sure that that's correct before the operation. Many of our patients are young, but we're doing more and more older patients. And gosh, when I say older, I'm the oldest one here, so that term is relative, but we say over 40. Those are mostly the facelift patients and breast lift patients and tummy tuck patients. We want a medical clearance from your primary care doctor before you come here. Ideally, if you can send us your blood work before you come here, we can check it and tell you whether or not you should do something to improve your hemoglobin. The hemoglobin is the number one test that is important for us in terms of your surgery. If you have anemia and the hemoglobin level is low, then we use an iron supplement to replace that. We can also do IV iron supplements for a quicker response. If the hemoglobin is too low, we cannot do the surgery. So if we have that value before you come to Miami, that would be fantastic. So we've talked about smoking, we've talked about medications, and the need for preoperative medical consults. We have a number of doctors here we use. For example, if there's any cardiac history or a patient over 50, those patients automatically get a cardiac or cardiology consult. We provide that doctor for you here in Miami. We have a number of doctors here we use who are specialists, who are aware of our procedures and aware of our clinic, and we feel very comfortable using them. But again, if you're at home and you need that consult, please go ahead and do that. Now, as far as when to come to Miami and when to leave Miami, we have patients from South America, Central America. The majority are from North America, as far as north as Alaska and Canada, and all 50 states combined. So these patients, we like to have them here before 24 hours before surgery. Flying, particularly in a flight that's more than 4 hours long, can increase the potential risk of a blood clot in your legs. And if that travels to the lung, it's called the DVT and pulmonary embolism. So we want the patient here in Miami 24 hours prior to surgery. We want the patient well hydrated, and incredibly important, drinking a lot of fluids, non-alcoholic fluids, and well rested. So those are the three things that we look at before the operation. The other thing now is that we prefer to have somebody come with the patient if possible, a family member. That always provides an additional level of comfort for the patient. But if that's not possible, we have recovery houses that do a very nice job in helping us with the recuperation of the patient. After surgery, depending on the procedure, we prefer you stay 3 to 7 days. That is determined by the extent of the surgery. Approximately half to more of my surgeries are combined operations, meaning 2 or 3 operations at one time. Those patients require a 7-day post-operative visit, meaning 7 days after surgery before you fly home. When you're ready to fly home, we give you a shot to prevent a blood clot on the plane. I don't want to overemphasize the blood clot issue because I don't want to scare the patients. It's extremely rare because we take all the precautions to prevent it. For minor, less extensive procedures like breast augmentation or lipo360, a visit of 2 to 3 days at the minimum is all that we need. When you leave, I want you to know you're not alone, and that's an important point. When you leave our center, you not only have a copy of all of your post-operative instructions in terms of faja use, facial surgery, and nutrition requirements after surgery, you also get a calling card with my direct number on it, in which case you can text or call us and we will return your call within 24 hours, usually within 8 hours. If necessary, we do a live FaceTime call and look at the direct problem. So you're not on your own when you leave Miami. We're here for you. If for any reason you need to come back for any minor revisions, that is usually taken care of without any hiccups at all. Okay, what I wanted to mention that if you have the lab work before you come to Miami, that's fantastic because we can review everything, the lab work included, and tell you anything that needs to be changed, and or if your surgery has to be delayed for one reason or another, that will prevent you from coming to Miami, us having to deal with the problem here. Okay? 90% of our patients have a clear and easy access to the surgery and a clear and easy recovery from the operation. So all of this is for the minor points that your doctor and our staff, we sweat the details so your outcome is excellent. There are some special considerations with patients, and the most common one is diabetes. Diabetes is 2 types, type 1 at birth or in childhood, and type 2, which is much more common in adulthood. The one lab we look at for diabetes is the A1C level. We like that to be at 6.3 or less prior to surgery, and that is something that's very important. The other thing that's important with the diabetes is that your diet is well controlled after surgery. Diabetes is associated with certain problems relating to wound healing, so we want that well controlled in your postoperative period. All of our patients get prescription medications. We provide that for you the day before surgery. You can go to the pharmacy, have that filled and at your bedside when you return from operation. The first medication is tramadol or Percocet, a narcotic that is used for pain control. We also have you buy ibuprofen, which you can take in addition to tramadol for pain relief. Ibuprofen is also an anti-inflammatory, which is very good for our postoperative recovery. Extra strength Tylenol can also be used. So those are the 3 medications for pain control. And most of the time, the pain is extremely well controlled. The next medication is called Zofran, and that you take orally if you're having any nausea. And the final medication is an antibiotic you take for 3 days following your surgery. Another common question is massages after surgery. Massages are definitely indicated for liposuction 360, liposuction with abdominoplasty, and or liposuction BBL. The frequency of massages should start at our facility where we have a state-of-the-art massage center here and be continued at home. I recommend a total of 12 massages, 2 a week for 6 weeks. If there's any stubborn areas of seroma or fluid collection, additional massages may be indicated. An informed patient is a happy patient, and we do everything possible to make sure that you know everything going on each step of the procedure. We're available for you pre-op, we're available for you post-op, and for an extended period of time after the surgery. I look forward to seeing you soon here at our facility.